Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Why do I bruise so easily? When you bruise easily, it can sometimes seem just as easy to identify the cause, such as advancing age or a blood thinner medication you're taking. But some people who develop large bruises, multiple bruises at the same time, or bruises, also called contusions, that happen without a known cause, may have an underlying medical condition. /r/n/r/n. Some of these conditions, like leukemia, can be serious. In other cases, the bruising can be a symptom of easily treated nutrient deficiencies. It's also possible that bruising can be a sign of abuse. It's important to see a healthcare provider for an accurate diagnosis and treatment, even if the bruises typically go away in a week or two. /r/n/r/n Ardell Getty Imagesrnrn Bruising occurs more readily as a person ages, making age the most common cause of easy bruising. Aging skin becomes progressively thinner, making blood vessels more prone to injury. /r/n/r/n Medications commonly prescribed to older adults, such as blood thinners, also contribute to easy bruising. Older adults also can be especially vulnerable to physical abuse. /r/n/r/n Frequent bruises can be a sign of physical abuse, whether in a child or an older person. Either the abuser or the person being abused may say that visible injuries are simply due to easy bruising. /r/n/r/n A vitamin K deficiency can lead to easy bruising. This vitamin plays an important role in blood clotting. A deficiency is rare but can occur in newborns, who are typically given a vitamin K injection at birth to prevent a deficiency. /r/n/r/n A vitamin K deficiency is seen in multiple conditions including /r/n/r/n Vitamin K is found in foods like soybeans, greens, spinach, kale, collards, etc., and organ meats. Supplements can also be a source of vitamin K. /r/n/r/n Iron deficiency anemia is a frequent cause of easy bruising. This anemia can result from a variety of circumstances, including inadequate iron in your diet or chronic bleeding. Some conditions, such as pregnancy or breastfeeding, can temporarily increase the need for dietary iron. /r/n/r/n In addition to bruising, symptoms of iron deficiency anemia can include /r/n/r/n Easy bruising can indicate low iron levels, but there are a number of other potential causes. Your healthcare provider can discuss the potential benefits of iron supplements with you. /r/n/r/n Your body's ability to form a proper clot can be affected if you don't have enough platelets, low platelet count, or they aren't functioning properly. This may result in bleeding and easy bruising. /r/n/r/n There are numerous causes of a low platelet count due to health conditions including /r/n/r/n Even a vitamin B12 deficiency can contribute to low platelet counts. /r/n/r/n Even with a normal number of platelets, bleeding may occur if these cells don't function properly. Platelet disorders interfere with the body's ability to properly clot blood because there is a lack of proteins in the blood, clotting factors, that help platelets form blood clots. /r/n/r/n Symptoms can include :/r/n/r/n Hemophilia is a rare genetic bleeding disorder that causes the body to be unable to produce one of the specific clotting factors crucial for clotting. Bleeding continues longer after an injury because the blood cannot clot it properly. When a blood vessel injury occurs, uncontrolled bleeding and bruising results. /r/n/r/n There are two types of hemophilia, type A, a factor VIII deficiency, and type B, a factor IX deficiency. /r/n/r/n Symptoms of both types include /r/n/r/n The symptoms of hemophilia can be mild or severe, depending on how much clotting factor is present in the affected person's blood. Depending on the severity and type of hemophilia, Bleeding may occur spontaneously, without injury, or after trauma or surgery. r/n/r/n von Willebrand disease, VWD, is a bleeding disorder that occurs when a protein called von Willebrand factor in the blood is lacking or not working properly. VWD is nearly always inherited and lifelong. Even though most people with VWD are born with the condition, it often remains undiagnosed until adulthood, as symptoms tend to be mild. r/n/r/n There are three types of von Willebrand disease. Type 1 is the mildest, type 2, and type 3 which is the most severe. r/n/r/n The most common symptoms of von Willebrand disease in decreasing frequency include /r/n/r/n Ehlers-Danlos syndrome, EDS, refers to a group of genetic connective tissue disorders that affects 1 in 5,000 people worldwide. /r/n/r/n EDS is classified into 13 subtypes, each with a specific set of symptoms, and each affecting a different part of the body. EDS is typically diagnosed at birth or in early childhood. However, it is possible to develop symptoms as a young adult. /r/n/r/n Common symptoms of EDS include /r/n/r/n Easy bruising can be a symptom of Cushing's syndrome. In this condition, the body makes too much of a hormone called cortisol. Cushing's is most often caused by long-term use of corticosteroid medications, but it can also be caused by a tumor. /r/n/r/n Other symptoms of Cushing's include /r/n/r/n People diagnosed with a mast cell disorder also may bruise easily. These immune system disorders, with subtypes that range from the comparatively mild to life-threatening, are genetic and rare. /r/n/r/n With mastocytosis, too many mast cells, a type of white blood cell, grow in the body. The main types include systemic conditions that affect the body, and cutaneous conditions that affect only the skin. /r/n/r/n Indolent mastocytosis, a systemic type, is the most common and least severe. The other types can be more severe and include /r/n/r/n Mast cell activation syndrome also can occur, with related symptoms and conditions that include irritable bowel syndrome, fibromyalgia, allergic responses, and other variants. /r/n/r/n Easy bruising can be a side effect of certain medications, such as /r/n/r/n If you are experiencing easy bruising as a side effect of medication, do not stop taking it without talking to your healthcare provider. In some cases, the risks associated with not taking a medication are more serious than the side effects it causes. /r/n/r/n Some herbs and supplements can cause you to bleed more easily, either when used alone or in combination with other medications. It's possible that this can cause you to bruise more easily as a result of platelet function and other changes. /r/n/r/n These herbs and supplements include /r/n/r/n You can take steps to prevent falls and remove hazards that might cause a bruise. /r/n/r/n If a medication is the likely cause of easy bruising, your healthcare provider can reevaluate the benefits versus the risks of continuing to take it. Do not stop a medication or change a dosage unless under the advice of a healthcare provider. /r/n/r/n To determine the cause of easy bruising, your healthcare provider will conduct a physical examination and review your symptoms, medical history, and any medications you are taking. /r/n/r/n Testing may be necessary, including /r/n/r/n Talk to a healthcare provider if you notice frequent bruising, especially if there doesn't appear to be an obvious cause. Other signs that you should get treatment for easy bruising include /r/n/r/n Easy bruising can cause large bruises in multiple areas of the body, often at the same time. The most common causes are raging or a medication side effect. Bruising also can occur due to bleeding disorders or other rare medical conditions. Frequent bruising may also be a sign of physical abuse. /r/n/r/n genetic conditions that cause you to bruise easily are often diagnosed with blood tests. In addition to easy bruising, bleeding disorders can cause frequent nosebleeds, heavy periods, and bleeding that does not stop after 10 minutes. Your healthcare provider can discuss treatment options. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.